If you're planning on having total hip replacement surgery or recently had it and your surgeon used a posterior approach, it's essential that you know the specific post-operative precautions that come with this type of approach to not only allow the hip to heal properly, but to avoid the dangerous positions and movements that delay tissue healing and that may possibly cause hip dislocation after this procedure. I'm Matt Segua, a doctor of physical therapy, and I've treated hundreds of patients who had total hip replacement surgery. And in this video, I'm going to explain the general post-operative precautions that come with the posterior approach for this surgery. And if you find this video helpful, please subscribe to the channel. Now, let's get into the specific post-operative precautions. Before we get into the specific post-operative precautions for this approach, let me explain generally what post-operative precautions are. So essentially, these are rules and restrictions that your surgeon wants you to abide by to allow you to recover properly without any mishaps or further injuries related to this surgery. Now, with the posterior approach specifically, there are three main things that you want to avoid doing while you're recovering. Now, in terms of how long to avoid these things, that will be recommended and instructed by your surgeon. They'll be very clear of how long they want you to abide by these precautions. And with that being said, every surgeon does have slightly different precautions. So the posterior approach precautions that I'm going to discuss are generally recognized by most orthopedic surgeons, but it's just a generalization of what most of them go by. Now, you definitely want to abide by what your specific surgeon recommends, but most likely they're these specific restrictions and precautions. So the first post-operative precaution is no bending at the hip past 90 degrees. So you want to make sure that while you're sitting, while you're lying down, your hip is never bent more than 90 degrees. So really, with this type of precaution, some of the common mistakes people will make that break this are when they try to put on a shoe or a sock, they bring up that knee towards their chest. That will break that precaution, can possibly lead to joint dislocation and definitely affect the tissue healing and the incision healing because you're really stretching that backside of the hip, of the glute muscles. Another common mistake that people will make is they'll be bending way too much at the waist when they try to stand up. So there are specific ways that we can teach patients to avoid this, such as having that surgical leg fully kicked out or extended in front of them as they try to bend forward and stand up, just so that their hip is a little bit less bent when the leg is extended. But when it's more bent at the knee or at the leg, that already puts your hip in more flexion or greater bend. So just making sure that when you're recovering, especially in that first 2 weeks, you're avoiding excessive bend. Nothing past 90 degrees is the first precaution with the posterior approach. So if you've been struggling with your hip replacement recovery, I created a list of some of my favorite Amazon products that I recommend to my patients to help facilitate their recovery. Some of the things that this includes are like ice packs that are specifically designed for the hip joint after surgery. So I'll leave a link to that in the description and the comments below. I'll also leave like a QR code on screen so you just snap a picture of that and you can just follow the link to these products. I'm not sponsored by any of these brands, so all of these products were handpicked by me and I found great feedback with my patients for all these products. They are affiliate links, so any purchases made from these links do help support the channel. The second precaution is no crossing the legs, especially no crossing that surgical leg over the non-surgical leg. So what this really does is because they cut through the glute muscles with the posterior approach, as you cross that surgical leg over, you're really stretching out those soft tissues significantly when you cross over the legs. So that's going to affect the tissue healing when you get into that position. So with people who tend to have the habit of crossing their legs, they're definitely instructed early on to be aware of their habits and make sure that when they're sitting, when they're lying down, their hips, their legs are parallel with each other. They're in a neutral position. There's no crossing over of the legs. One of the other instances that this can be an issue with is when they're sleeping. So what we generally recommend is when you're sleeping on your back, or if you're sleeping on the side, non-surgical side, there's a pillow between the knees, but generally they're recommended to sleep supine on their back with a pillow between the knees, possibly a pillow or a bolster underneath the legs to also help with some swelling. But the main thing is you don't want to be sleeping on your side with the legs crossing over. You want to make sure that the legs stay parallel with each other and in a neutral position, no crossing of the legs. The third precaution is you want to make sure that there is no pivoting on that surgical leg. Specifically, you want to make sure that you avoid having that surgical leg pivoting inward. So if you were to have your surgical leg, so my right foot facing forward, I want to make sure I don't have it in a position where it's planted on the ground and now I'm going to rotate my body towards it. So essentially that would be the same as crossing the leg, where you're just rotating that foot inward. So if my surgical foot is facing forward, but my torso turns towards that foot, then that would be breaking that precaution. You want to make sure there's no pivoting, no internal rotation of that hip joint. So really, whenever you're making a turn, you just want to focus on just lifting up that leg whenever you're trying to turn your body. So that's how you be safe with this type of movement. Whenever you're going to make a turn, you just lift up that foot, lift up that leg, and do small steps just to make sure that you're not pivoting. So this is one of the precautions that people often get confused with. Which way can I pivot? The main thing is there's no pivoting. We're picking up the leg and the foot whenever you have to make a turn. So that way you avoid any confusion, but specifically to make sure that you allow the hip and the tissues to heal appropriately. Just making sure that the surgical foot doesn't rotate or point inward. You want it to stay in a neutral position. You also don't want it to point outward, but essentially the more risky and dangerous position is if that surgical foot points inward. So just keep it in a neutral and straight position. One of the other instances that people can have this is while they're lying down in bed. If there's nothing supporting their hip and their surgical leg in place, then that allows the leg to move or rotate kind of freely. So sometimes you'll get discharged with a bolster that keeps your leg in a neutral position, so there's no crossing over like we mentioned before, but there's also no rotation. It kind of keeps it just in a straight line and in a neutral position at the actual hip joint. But if you aren't discharged with one of those bolsters, another thing that you can use is just using pillows and blankets on both sides of the leg to make sure that the actual leg, the foot, aren't able to physically rotate inward or outward. It's positioning pillows and blankets on either side just really keeps it in a neutral position where that foot is essentially pointing straight forward or up towards the ceiling while you're at rest. So making sure that you're avoiding pivoting on that surgical leg, especially with that toe or that foot pointing inwards. All right, so to recap, the 3 post-operative precautions that are associated with a posterior approach: no bending at the hip past 90 degrees, so that means no hip flexion past 90. No crossing of the legs, especially that surgical leg. You don't want that to cross over. So in a sitting or lying down position, no crossing of the legs. Just keep the legs neutral and parallel with each other. And the third one is no pivoting on that surgical leg, especially no letting that surgical leg and foot point inwards towards the body. You want to keep it always straight forward. It's also good to avoid external rotation or having the foot pointed out. So to be safe, just keep that foot pointed straight forward, and whenever you try to make a turn, you just pick up the feet, pick up the leg of that surgical side, and just do small steps whenever you're making a turn to make sure you follow the post-op precaution.